With preparations for mass production of personal protective equipment for health workers currently on the forefront of fighting the coronavirus pandemic underway, Kenya is readying itself to produce medical protective equipment. But the country is still running behind in meeting the required standards, and the prototype on gears such as coats, coveralls, scrubs and aprons are not of approved quality.
We are happy with what they have done, but the only gap is this slight penetration of water. And that is not a big deal. That is something that can be done within a very short time.
The surgical and community masks manufactured here have been approved, as the samples for the other gears await modification before approval for mass production. Medical practitioners say the demand for the personal protective equipment is rising by the day, as one PPE is required per patient being attended to at the hospital.
Our main mission is to ensure that our people are safe, our clinicians, our health workers are safe. That what we can do is to expedite the process so that we finish this process as early as possible.
The government says that the community masks will be available only to vulnerable communities.
But targeting informal settlements, because again we are cognizant of socioeconomic realities in this country. And therefore the government is seized of the matter, is very much aware of it, and as soon as they are ready, they will be distributed, but not to each and every one of us. Let that be clear to everyone.
This comes as the government reveals that one full kit of PPE for a health worker costs about 20,000.
Because the suit itself now is about 15,000. Now when you add the goggles, which are going for about 3,000, then you add the gloves, which are about 150, and you add the shoes, so you're looking at a disease that is so expensive to manage.
But with the demand for community masks also rising, the hygiene of the masks on the streets is said to be worrying, with Kenyans being warned against fitting the mask before buying, as it poses a risk of spreading infection.
All of us are really out there making masks even in our own homes, and I think this has to come out. It has not been addressed fully, but we need to do this. But handling masks with your dirty hands, we've seen even some at the supermarkets where somebody comes and tries and finds it's too small and puts it back in the lot.
Those that live by each day, and we must be, as a government, be conscious of that. And therefore, we will not go to the streets to look at which masks are being, vended by who. But we are asking our people through you that everybody must be conscious of the type of masks that they are actually, buying.
Already 3 textile industries located in Athi River, Kitui and Nakuru have been identified for mass production of the PPEs. Kamchemenza for Channel 1 News.